should be good. Good evening. This is Dr. Carmela Sgarlata coming to you from Portland, Oregon, from Oregon Reproductive Medicine. Thank you very much for joining us tonight for Preconceptual Health Fertility Optimization webinar. I hope that the next 45 minutes or so will be very helpful for you, whether you're just beginning your fertility journey or somewhere in the throes of treatment at this point in time. Hopefully we'll have some time at the end for questions, and there is a chat session that you can submit questions. So let's get started. So one of the important things we want to talk about tonight is preconceptual planning. One has to remember the amazing number of steps that occurs for a pregnancy to occur. This list that I've listed below is a very small list of the many events that have to happen. But primarily I tell patients we have to think of the process of the production of a normal healthy egg, the production of a normal sperm, the ability of the sperm and egg to get together, and then once the egg and sperm gets together, the woman's body being able to nourish and support pregnancy for the 9 months. So all of these events have to work in sequence and together for a successful pregnancy to occur. When we talk about preconceptual planning, patients often ask me, how long in advance, Dr. Sgarlata, should I plan for pregnancy? And my funny answer is all of your life, but that's usually not practical for most of us. So what we do like to think is ideally preparation of a 3 to 6 month period of time. Now that might surprise you to think 3 to 6 months, but that's based on really how eggs and sperm develop and mature before they're ready for fertilization. So in women, we believe that perhaps as much as 3 to 6 months before an egg actually releases from the ovary, that egg is beginning to wake up within the ovary, undergoing developmental events that ultimately release to the egg and hopefully a successful pregnancy. So things that might happen in those preceding 6 months could have impact, both positive and negative, on the ability of that egg to develop normally and result in a normal pregnancy. In men, we typically think at least 3 months. And this is based on the fact that men have constant production of sperm. We're producing new sperm cells daily by the tens of thousands to millions. And that process takes about 3 months. So over the 3 months, sperm are being produced, they're developing and maturing. So anything that might interfere during a 3-month period of time when those sperm cells are first being developed until the time they're ready to leave the ejaculate can have a negative influence on sperm number and quality. We also know that this is an important time for health because there may be changes within the DNA or genes of both the egg and sperm that will ultimately affect the health and outcome of the pregnancy and the long-term health of the fetus. Once the woman is pregnant, this is a very important time to be prepared, to already be on prenatal vitamins, to make sure the proper medications, if a woman is taking medicines, are ones that would be safe to take while pregnant, and to control any chronic medical conditions or diseases. Because that first 7 days or so from when ovulation occurs to implantation, where the embryo actually sticks to the wall of the uterus, we don't know if we're pregnant or not. And the fetus is most vulnerable to external influences in the first 2 to 6 weeks of pregnancy. So as you can see, the preparation ideally should start well in advance of actually becoming pregnant. So what we're going to talk about today, and we're going to consider some important issues for preparing for pregnancy, and what I'm going to say is equally important for both men and women. We often tend to emphasize fertility issues for women, but we know men are a very important and equal partner in this process. So we're going to discuss about genetics, lifestyle, diet, environment, and how they might influence the ability to conceive, one's general health and well-being in pregnancy. One thing I always tell patients, we're going to go through a lot of content this evening. Pick out 2 or 3 areas that you think are important for you and begin to work on. Don't expect or try to change your entire life in one day or night. It simply won't work. So when we plan for pregnancy, one of the things that patients actually wonder about is, well, how long should I wait if I'm attempting pregnancy before I become concerned? The medical definition of infertility is 1 year of regular unprotected intercourse without pregnancy. We generally say if a woman is over 35 years of age, she might consider being evaluated after 6 months of attempting. But one of the facts that people often don't understand is, what is the chance of getting pregnant in any given month? And unfortunately, even when everything is working well and timing goes perfectly, pregnancy doesn't occur every month, either naturally or through treatment. In fact, we'd like to say that under the right conditions, when a couple is just beginning to attempt pregnancy for the first time, average monthly pregnancy rates, meaning becoming pregnant in 1 month, are about 20 to 25%. But that's also based on the age of the female partner, and that's what we see on the slide here. If we look at age 35, we have 18% if we're trying for the first 3 months. But if we're 40, that chance of pregnancy in any given month drops to 7%. And that's related to the increasing issues of maternal age and how it affects the ability to become pregnant and have a successful pregnancy. So at the end of 1 year, approximately 80 to 85% of women who are under 35 years of age, we hope, are going to be pregnant. And that's how the definition of infertility has come about. Age is an important factor, as I mentioned. We're going to talk about both maternal and paternal age. We've heard of the biological clock, and unfortunately, it is a real event. In women, fertility begins to change or slightly decline, actually beginning in the early 30s. And on this graph that we see in the blue line, this is actual fertility, if you would. And we can see that that fertility rate drops, and it begins to drop in the mid-30s and has a more precipitous drop in the mid and late 30s and the early 40s. And certainly by 50 to 55, most women are not able to become pregnant. Along the same time, a time of decreasing fertility, where it's more difficult to get pregnant on a monthly basis or overall, we see the lower gray line, and this is miscarriage rate. And unfortunately, with increasing age, which we see along the axis, we also see at the time where fertility is beginning to decline, we start to see that miscarriage rates begin to increase. So at age 30, where miscarriage rates may be 10 to 15%, by age 40, miscarriage rates are approaching 40%, and by age 45, they may be as high as 90%. So age does matter for women. That doesn't mean that a woman at 35 or 36 or even 44 cannot become pregnant. But it does tell us that it can be more difficult, and unfortunately, pregnancy outcomes may not be as successful. That's why we suggest in women over 35, if they're having difficulty conceiving after 6 months, to seek counsel from their provider and begin an evaluation. For men, we don't see the same decline in fertility. There is a slight and subtle decline in males' fertility beginning in the mid to late 30s and early 40s. And there's really not the same significant decline in fertility for men that there is in women. So men are able to father children into their 50s, 60s, and 70s. There really appears to be no age limit for men to father children. However, we do see that with increasing paternal age, we'll start to see some changes in sperm quality, primarily sperm movement and the morphology. And we also know that it may take a longer time for couples to conceive if the male partner is older. So there is a male biological clock, but it is more subtle than that of the female. So we have to figure that in. I like to talk about age, especially if an individual or couple are considering having more than one child. We want to consider family planning as looking at the overall family size a couple wants. So if a woman is 35 and she first begins to have her family and she'd like 3 children, we'd like to be able to plan on how that might be possible for her to have those 3 successful pregnancies. Part of what we want to talk about today, and we may be having an audience that's quite wide. Some patients just beginning to seek information about becoming pregnant, fertility, and other patients, as I said earlier, maybe in the throes of therapy, have done treatments or IVF. But a little bit about fertility timing, because there are some misunderstandings about this. We all have heard of the menstrual cycle, and day one of the menstrual cycle is when the woman's period begins, and the typical average period cycle is 28 days. Between 25 and 35 is considered normal. Most women ovulate about day 14 to 15 of their cycle. That means 14 to 15 days after their period begins, or depending on their cycle length, 14 days before their next period. What we do know is the timing of intercourse is important for pregnancy. To have the best chance for pregnancy, intercourse needs to occur preceding or right around the time of ovulation. So generally, if intercourse occurs within 2 to 4 days before ovulation, that is going to give the best opportunity for pregnancy in that cycle. Once ovulation has occurred, especially beyond 24 hours, conception is quite unlikely. And that's what this graph shows, that the bulk of pregnancies are going to occur around the mid-cycle or ovulation time. So if you have any questions about when you're ovulating, discuss those with your provider. They can give you further guidance, especially if you have irregular or erratic periods. Another area of misinformation is that about intercourse timing or technique. And to keep it quite simple, the best intercourse for pregnancy is regular intercourse around ovulation every day or every other day gives the highest chance for pregnancy. For most men, if they have a normal sperm count, having intercourse or ejaculation every day or every other day will not exhaust them, and they'll be able to maintain excellent sperm counts. So frequent intercourse should not dramatically change men. In fact, one of the things people talk about is so-called store-up, where men will wait or abstain for 2 or 3 weeks and then have intercourse only around the time of ovulation. That's not a good idea. While the sperm count may go up and the volume of fluid goes up, the actual quality of the sperm, the motility, and the morphology declines because those sperm have been in the system too long and have gone past their most fertile time. So store-up is generally not a great idea. There are no specific guidelines for time of day, the position of sexual intercourse, or rest after intercourse. None of these have significant impact on the ability of a woman to become pregnant. One area that's often asked is about lubricants. So there are a number of different lubricants available. One of the issues with lubricants is some of the lubricants may actually be spermaticidal. What that means is they may kill off or they may alter the function of the sperm, making the sperm not fertile. So generally we look at some fertility-friendly lubricants. Canola, almond, and olive or coconut oil actually work quite well. And there's hydroxycellulose-based lubricants on the market that have been shown to be non-sperm toxic. So if you have a question about or need a lubrication, certainly talk with your provider or your pharmacist, and hopefully they can guide you to a good product. Genetics. When we think about genetics, we really think about 2 areas or arenas in genetics nowadays. One is what we call the intrinsic biologic factors. That's the DNA, the 46 chromosomes that we're born with, that we inherited from our parents, and the genes that make up all of our different traits and characteristics. These we are born with. We can't substantially at all alter those, although technologies in the future may allow that. But there's another area that we do have potential influence on, and these are called intrinsic factors. We also call that epigenetics. And epigenetics, in a very simple way, is really how the genes that we have are influenced by environment. And there are different things that can turn genes on and off that cause them to function either normally or abnormally. And these can be influenced by lifestyle, by environmental factors, by nutrition and supplements. So we have to think not only of the DNA we're born with, but also those influences in our lives that may alter how our DNA functions properly. That's the concept of epigenetics. Certainly lifestyle can have significant influence on our fertility and ability to have a normal pregnancy. I can think of no positive benefit for smoking or vaping for fertility for both men and women. In fact, we know cigarette smoke and vaping can alter ovulation and also alter sperm function. So in an individual or a couple who is smoking or vaping, it's in their best interest to stop smoking or vaping before attempting pregnancy. It definitely would like all women who are pregnant not to be either smoking or vaping with the current information we have. We know that weight can have a significant influence. Women who are very underweight or very overweight may have reduced fertility. They often have irregular periods or lack of ovulation. Very vigorous or extreme exercise can influence women's fertility by altering their menstrual periods and ovulation. Shift work. Women who work the graveyard, the 11 to 7 shift, have a greater incidence of irregular periods and may have greater difficulty becoming pregnant. So something to think about if you're working that 11 to 7 shift. Caffeine, there's a lot of questions about caffeine. I certainly like my cup of coffee in the morning. How much caffeine is safe? If we look at the best data we have right now, about 200 milligrams of caffeine consumption a day. Now, 200 milligrams would be roughly the equivalent of 12 ounces of regular brewed coffee. Tea does contain caffeine, chocolate contains caffeine, but it's in much lower amounts. So I typically tell patients, for my women, 1 to 2 cups of coffee a day should be the maximum they could consume. Also, alcohol. What is a safe amount of alcohol? Well, once pregnant, we advise no alcohol. But while attempting pregnancy, between 2 to 4 beverages a week seems to not influence fertility negatively for either women or men. And we'll talk a little bit more about what a serving of alcohol is in a minute. And certain herbal preparations or over-the-counter preparations have both potentially fertility advancing properties, but some may actually have properties that alter or reduce fertility. For men, as I mentioned, cigarette smoking and vaping. Heat is important for men. Men who work in high temperature environments may have lower sperm counts and lower sperm motility. There's a recent study just published that again showed men who wear boxer shorts seem to have improved sperm counts over men who wear briefs. Whether or not that relates to fertility issues is open to debate. EMR, electromagnetic radiation, primarily cell phones. We know that cell phone radios give off a small amount of radiation. That radiation can affect sperm in the lab, and there's a concern that it may affect sperm in the body. So I tell all gentlemen who are attempting pregnancy to keep their cell phones out of their front pants pocket for that reason. For men, vigorous exercise does not seem to have negative influence on their sperm production or quality. Alcohol is the same. We say less than 4 beverages a week. And one area we have to be careful about in men is men who may be using anabolic steroids or supplements to improve muscle mass. Some of these supplements contain high levels of androgen, male-type hormone, and high levels of male hormone can actually have a contraceptive effect and lower sperm count, or in some cases, yield a gentleman without any sperm production at all. So alcohol is an interesting area, and I just want to go over with this slide, what is a serving of alcohol? Well, a serving of alcohol would be 12 ounces of a typical beer, usually around 4 to 5% alcohol content. With some of the fortified beers we have, that might be 8 to 10 ounces. For wine, both red and white wine, a serving is considered to be 5 ounces. And for hard alcohol, depending on the proof or alcohol content, 1 to 1.5 ounces. So that is a serving size. When we talk about 4 servings or less of alcohol a week, we also advise that individuals spread that out over the week and not imbibe in all 4 beverages at one time. What about marijuana or cannabis? There are now 28 states, I believe, where both recreational and or medicinal marijuana is now legal. Oregon, the state that I'm speaking from, has both recreational and medicinal marijuana. We do know that cannabis has a number of properties. CBD and THC are the more active ingredients. THC is the psychoactive ingredient that people talk about. And its metabolites, its activity can last in the bodies for as long as 2 to 4 weeks. We know that THC can cross in the woman to the fetus across the placenta, and we know that both THC and CBD are found in breast milk, so that we know that these compounds can pass across to the fetus. In women, It's been described in some studies that they may have more irregular periods, lack of regular periods or ovulation, who regularly smoke or use marijuana. There has been a higher risk of prematurity observed. This may be not so much to marijuana, but perhaps to the inhalation of the smoke, because we know women who smoke tobacco also have an increased risk of prematurity. And there has been concerns, they're not proven, but concerns consist of cognitive impairment, learning disabilities, or underachieving intellectually in offspring of women who use chronic large amounts of marijuana. This is an area under active investigation. For men, some men, marijuana can actually interfere with the production of testosterone, and testosterone is important not only for libido, but for normal sperm production. So it can lead to a reduction in sperm count, motility, and libido. One thing that we have currently, a lack of knowledge of the safety of edibles and oils. Almost all the information on marijuana use is through the inhalation form. And at this time, there has been no safe amount of marijuana proven for pregnancy. I would say the same for fertility. It's certainly at this time unknown, and I advise my patients to avoid the use of marijuana when they're actively attempting pregnancy, and definitely once a woman conceives. Until we have better information, that's the best we can advise you. As I mentioned, weight is important, and optimizing weight before pregnancy is important for both men and women. Now, there's a system that's used called the body mass index, and that looks at one's height and weight and tries to look at body composition. And in the United States, a normal BMI is considered 18 to 25. Many of us are over that. But what we do know in women who have a BMI less than 20, especially lower than 18, they have a higher risk of having ovulatory disorders. What that means is periods may become less regular, or no periods or no ovulation at all, and that certainly can lead to infertility. In women who have an elevated body mass, over 30, which is considered obese, and especially in women with a BMI over 40, which is considered class 3 obesity, we know that there's again an increase in ovulation disorders, lack of regular ovulation, and there also is an increased risk of poor outcomes for pregnancies, what we call obstetrical outcomes, including miscarriage, neural tube defects, a condition where there's an opening in the base of the spine and brain. Spina bifida is one that you may have heard of. There's an increased risk of pregnancy-induced hypertension, high blood pressure in pregnancy, gestational diabetes, preterm delivery, and increased risk of cesarean section. And lastly, in women who are very overweight, an increased risk of macrosomia. Macrosomia is the term for the babies being very large. That can lead to a difficult or traumatic delivery. And we know that women that are very overweight, their children tend to also develop obesity as they age. So weight is a very important issue that can influence fertility negatively for women. In men, it seems that body mass index above 35 has more importance than below that. And what happens in those men is we begin to see some changes in their hormone production, which leads to reduced sperm count and sperm motility. Motility is the movement of the sperm, and that's important for the sperm to function normally. So if somebody is extremely underweight or very overweight, it really is important to try to get back to a more normal or closer to a normal body weight for that particular individual before they attempt pregnancy. I get a lot of questions about diet, and certainly if you go to the bookstore or the library or research on the internet, there are a lot of opinions on so-called fertility diets and what are the best diet. And in my opinion, looking at the medical literature, the published studies we have, reviewing what's available, I think the best diet that we see for fertility is based on the Mediterranean or anti-inflammatory type diet. And that is a diet that tends to be rich in plants, fruits, and vegetables, whole grains, beans, and legumes, reduces the amounts of saturated fats, refined sugars, and processed foods, trying to go to nutritious whole foods rather than processed or quick foods. One thing on this slide, the Mediterranean diet does include moderate wine, as you see here, That's for individuals not attempting pregnancy. The Mediterranean diet suggests 1 to 2 glasses of wine a night. That's certainly far above what we'd like for couples attempting pregnancy. But what it also doesn't include is water daily. And I tell patients to aim for 64 to 100 ounces of water daily, and water should be the preferable fluid. The Mediterranean diet, or any inflammatory diet, in addition to diet, also looks at lifestyle and physical activity and advises that we be daily active, that we move so that we're not sedentary but active. So a combination of both this diet and activity appear to have the greatest benefit. There's a number of different diets out there. When I talk about eat healthy, we want to try to eat a well-balanced diet. We should eat 3 meals a day and not skip meals. 1 to 2 small snacks is certainly fine. As I mentioned, fluid intake, 64 to 100 ounces of water a day. We want to increase the lean proteins we get and increase fiber, reducing things that have simple sugars or processed sugars or simple starches. So instead of a pulverized grain, we'd like to rather eat a whole grain type product. Processed food or food products should be avoided because they tend to have increased amounts of fats and sugars. And choose foods from a fat standpoint that are high in monosaturated fats. The gold standard for monosaturated fats would be olive oil, but also canola, peanut, sesame, and sunflower. Avocados are a good source of monosaturated fats. I have a few rules to eat by that I generally advise patients to think about. Before we talk about that, this little area here called My Plate, I don't know if you can see on the screen, it says choosemyplate.gov. That's a new government campaign for us to talk about food portioning. And the thought is that in the Mediterranean type diet, about half of the plate should be fruits and vegetables. A quarter should be our source of protein and a quarter should be our source of grains, with a small amount of dairy allowed. Dairy is not evil. In fact, from a fertility standpoint, whole milk may be the preferable form of milk. I do advise all patients using dairy to use organic dairy and look for antibiotic and hormone-free dairy products when at all possible. I talk to patients about aiming for color, eating across the rainbow. Below the My Plate, we see a bowl with vegetables and nuts and grains. All of those colors are different pigments. They have antioxidant activities. These are very potent chemicals that can help improve our digestion and improve our general body function. They can also reduce inflammation within our body, making a healthy environment for conception and pregnancy. So that's when we talk about aim for variety and color or eat across the rainbow. I mentioned not skipping meals. Portion control is the concept of looking at that plate and not supersizing. I think that we should make food, when possible, a social event, not eating alone. We tend to eat better and more nutrition when we eat together as alone. And I also think it's very important to take time to eat our meal and just not rush it down. We do not digest our food as well when we're rushed. Certainly, we don't eat when we're on the phone or computer or driving. We're certainly not going to digest. We're not relaxing, enjoying the meal. So slow down, enjoy your food, enjoy your meal when you can. I do realize there are times where we have to eat kind of on the run because our daily schedules are quite busy. Staying hydrated. Cooking at home is important if possible because that way you can control the sourcing of your food, the quality of the food, and the portion of the food. You can reduce things that might be added in by restaurants or takeout food situations. Food prep and storage is important. And just a couple quick words on food storage. I advise patients when possible to store their leftover food products in glass, not plastic. Avoid foods being stored in plastic, especially hot liquids. The same is true for liquids. I would prefer that we use glass, ceramic, or metal containers for our fluids, especially hot fluids. Plastics contain different compounds, bisphonates and phthalates. These are known as endocrine disruptors. They can leach into our food and water and can affect our hormonal environment and have potential to affect our fertility. And organic foods is important. There are a lot of different labels for organic foods. I do believe that we should strive to try to buy organic dairy, as I mentioned, organic eggs and poultry if possible, looking again for antibiotic and hormone-free foods. One other area is produce, and there's a group called the Environmental Working Group that annually puts out a list called the Clean 15 and the Dirty Dozen. And the Dirty Dozen are those 12 fruits and vegetables that have the highest amount of pesticide residue on them through agriculture. The Dirty Dozen are the 12 that one would ideally want to buy organic, where the Clean 15 do not have to be organic purchase for fruits and vegetables. A good site for environmental information is the Environmental Working Group, ewg.org. What about vitamins? Well, vitamins are a complement to a healthy diet, and I mean that. They're not a substitute. There is no perfect vitamin. There is no perfect supplement that we can take. We should try to get the bulk of our nutrition from our food. And we know that even the best prenatal vitamins on the market are not going to provide us with 100% of our daily needs for vitamins, minerals, and other antioxidants that we need. For pregnancy, however, we do advise that all women attempting pregnancy receive at least 400 micrograms or 0.4 milligrams of folic acid daily in a supplement. And ideally, that should be started 1 to 3 months before attempting pregnancy. In women who are overweight, especially with a body mass over 35, we might consider actually increasing the amount of folic acid to 4 to 5 milligrams. So that's something you might want to discuss with your provider. But definitely folic acid should be started at least 1 month before attempting conception. And that's for women. Vitamin D is important, especially here in the Pacific Northwest. We tend not to get a lot of sunny days, so our vitamin D levels tend to be lower. There is evidence that low vitamin D levels may have a negative impact on fertility and may also have negative impacts during the pregnancy for women. So I suggest that women have their vitamin D level tested, and if it's low, then an appropriate supplement above what might be in their prenatal or daily multivitamin. Omega-3 supplementation, omega-3 are some of the different fatty acids that we obtain. The major source of omega-3 are going to be fish or nuts, and it's recommended that once a woman is pregnant, that she obtain about 250 to 300 milligrams of DHA daily. So an omega-3 or fish oil supplement could be an important supplement, especially once a woman is pregnant. How about environment? There are a lot of different environmental toxins or chemicals we come in contact with. There are certainly chemicals. One of the biggest ones would be plastics that are in our environment, solvents, pesticides certainly, although hopefully pesticides are being used more prudently. Cleaning agents, cosmetics, personal care products have a lot of different chemicals. And if you look up personal care products that one of us might use, you'd be surprised how many compounds are in there and how many might have negative influence on fertility. There's certainly infectious disease or biological, and there is that concern of Wi-Fi, as I mentioned earlier, electromagnetic radiation from cell phones for sperm. Most of us are not in an occupation where we're going to have occupational exposure to radiation, although someone in the medical field might if they work in the radiology department. And then we have physical, such as heat. And today in Portland, unfortunately, we have among the worst air quality in the United States, and it's due to the wildfires here in the Pacific Northwest. So secondary smoke or secondhand smoke, as well as ozone pollution, can have negative influences on fertility. Radio frequency energy from cell phones. In 2017, in December, the California Department of Public Health actually put out a statement plan, and they suggest that all patients, all of us, keep our cell phones off of our body and do some certain things to try to reduce our cell phone exposure. This is for general health and fertility in general, but from a fertility standpoint specifically, keeping cell phones away from the front pockets in the groin area in men is very important. So from an environment, what I advise patients is ideally to drink filtered water, know your water sources, avoid if at all possible plastic containers using, as I said, glass, steel, or ceramic. There are foods that are potentially contaminated. One source is fish. Some of the large sea fish, such as sea bass, mackerel, and swordfish, may have higher levels of mercury due to mercury contamination in the oceans. So the FDA and EPA suggest that we should limit our fish consumption, especially of these fish, to no more than 8 to 12 ounces of fish a week. There are a number of different sites you can go to. The Monterey Bay Aquarium has an excellent resource called Seafood Watch, where you can get more information about the contamination of fish in your local area. BPA, bisphenol A, and other bisphenols have been used in food products as liners. This is an endocrine disruptor that can influence fertility negatively. It's also found in concentrations in cash register receipts. So I tell patients to try to avoid cans, especially cans that have BPA canned foods, and also cash register receipts. Phthalates are in a number of different products. Again, plasticizers, they're in plastic. They're in a number of different chemicals that we might have in our homes, such as scenting, cleaning products, and personal care products. And exposure to high amounts of phthalates can influence ovulation and sperm production negatively. Definitely should be very careful about raw meat, fish, and dairy products. I mentioned personal care products because of the chemicals, things such as moisturizers, cosmetics, gels and fragrances. Gels and fragrances, again, generally have phthalates within them. Pesticides, obviously, we want to keep our pesticide exposure to an absolute minimum. Cat litter, cats can act as an intermediary to a parasite called toxoplasmosis. And if a woman is pregnant and becomes exposed to toxoplasmosis, it can have some very troubling problems for the infant. So if you do have a cat and it's an indoor cat, I tell patients that's probably safer. If it's an outdoor cat where it might contract toxoplasmosis from rodents and other, women should avoid the cat litter or cat feces. Heat. For men, we should avoid hot tubs, saunas, and jacuzzis when we're attempting pregnancy because these can negatively influence fertility. And unfortunately, gentlemen, that means 75 to 90 days because sperm production cycles are affected up to 90 days after high heat exposures. In travel, we have to be more and more aware of infectious disease warnings. What comes to mind is the Zika virus and the concerns that we currently have about travel to certain areas. Something you can discuss with your physician or go to the CDC, the Center for Disease Control website, an excellent resource for travelers. Movement and exercise. I'm not going to spend much time talking about it. You can see the slide. But really the take home is that exercise in moderate amounts actually can improve fertility for both men and women. And what we advise is at least 30 minutes of physical activity, at least 5 times a week. Now, if you can't get 30 minutes at a time, even 3 or 4 times where you split it into 5 or 10 minutes at a time is going to be good. Interval activity is better than no activity. Increasing physical activity can improve health and well-being, can improve both ovulatory quality, the ability of the egg to develop properly, as well as sperm development. For women, it's important to also include in their physical activity doing some upper body or strength training 2 or 3 times a week. Now, there may be exceptions to this depending on your health or medical conditions, and that's something your provider can guide you with if you have any specific questions. Sleep is important. It's certainly important for health and well-being. It's important for fertility. From a fertility standpoint, the sweet spot for sleep is at least 7 to 8 hours of sleep nightly, and hopefully that's good quality sleep. It's not enough to sleep 8 hours, but if you're getting up 3 or 4 times and taking 2 hours each time to get back to sleep, that's going to be poor quality sleep. You're not going to be rested, and that can have negative influences on your ability to successfully conceive. So I think it's important to think about sleep. As far as night shift, there is some evidence that women who have night shift or working at 11 to 7 shift, maybe 3 or 4 nights out of 7, can disrupt their ovulation, especially when they're going through some of the fertility therapies such as IVF. It might be ideal that they can reduce that night shift and get back to a more regular daily routine during that time. I'm a great proponent of self-care when we're going through the process of attempting or becoming pregnant. And one of the big things that I tell patients is me time, ME time. Make sure we take some time for ourselves, be present to the moment. It's important that we disconnect from the electronics that we have from time to time and rest, especially before sleep. We know people that watch TV, do a lot of gaming, do a lot of computer work right before they go to bed. They often have sleep disturbances. Social media can be wonderful, but it also can be a great time sink, so I think we have to be careful. And I do guide patients that be very careful about social media when it comes to fertility. There's a lot of unfortunate misinformation on websites and blogs about fertility that aren't really medically valuable. So if you need some resources, again, ask your provider. Hopefully they'll be able to guide you to some honest, well thought out resources for fertility information. So time is important. Our time management in that me is very important. One of the questions that I get in the fertility management is, are there other things that we can do besides traditional medical treatments to enhance our fertility? And I want to just make one point. If you're just beginning on the fertility journey and you're beginning your fertility evaluation, get your basic fertility evaluation done. Know what you're up against before you start treatment. That will give you your best chance of success so that you don't waste time in running on treatments that may not ultimately be successful for your situation. We know that about 50% of patients who are undergoing fertility therapy actually use some form of what are called complementary or integrative health therapies. And complementary therapies come in a variety of types. The most common would be supplements, mind-body tools, things such as yoga, mindfulness, meditation, or whole body systems such as traditional Chinese medicine, TCM, Ayurveda, naturopathy, and acupuncture. So there are a number of different modalities available for complementary therapies. All do not work for one patient, and because they may work for one doesn't mean we should use all of them. There are two nice resources that I refer patients to. I often get asked, what books do you recommend? One is the blue book called Be Fruitful by Victoria Mazies. This is an excellent book talking about lifestyle and how one can prepare for pregnancy and for successful pregnancy. And the second is Conquering Infertility by Alice Domar. This is an older volume, but it's an excellent volume to talk about taking control of one's life and doing stress management tools to help, if you are facing infertility, make the journey a little bit easier. So those are two resources that I highly recommend to patients. There are a number of supplements used for women. This list is far from complete. I simply put it up to show you that there are a lot of different things that have been advocated for the use of fertility and enhancing fertility for women. Unfortunately, the vast majority of these have very little scientific evidence to show that they're of benefit. We simply don't know. So before you start a supplement, I think it's important to understand what that supplement's going to do for your particular case, whether you're a gentleman or a lady, how long you should be on it, and what is the proper sourcing and dosing. For men, there also are a number of supplements that have been advocated. And interestingly enough, supplements in men have been more well studied. We have better information, so we have better information to be able to say that certain supplements for men actually have benefit. Antioxidants, a diet rich in fruits and vegetables. Folic acid can be beneficial to men with low sperm count and motility, as can vitamin C and E. Fish oil supplements or omega-3 supplements are helpful, as well as L-carnitine. And then some micronutrients, zinc and selenium, have been found to be helpful. Herbs, there's less information. But before you jump in and take all of these, gentlemen, if you've had an abnormal sperm test, talk to the physician, see what evaluations should be done to see if there's a correctable reason or what supplements might be best for your particular situation. There are some ways for men to boost their natural health of sperm. We talked about sleep. I mentioned about avoiding store-up or long abstinence. Keeping laptops off the lap. We think that's important to avoid heat and electromagnetic radiation, just like the cell phones in the pockets. What about boxers? There was just a new study you may have seen last week that came out of a very good program that showed men who wore boxer shorts tended to have higher sperm counts and more sperm movement than men who wore briefs. Now, in this study, whether the man wore boxers or briefs, these gentlemen still had normal sperm counts. But what it did show is men wearing boxers may have slightly higher count and motility. That may be important for fertility, especially for men where their sperm count is at the low end or below the normal range. Certainly wearing boxer shorts will not harm fertility. The question remains, will it dramatically, if at all, improve fertility? Eat carrots and walnuts. Well, carrots have carotenoids, which are antioxidants. Walnuts are high in fiber and omega-3 fatty acids. And there is one study that shows by eating a small amount of walnuts, 5 or 6 walnuts a day, can actually improve sperm count and motility. It does, we're not sure if it improves fertility rates, but it certainly can account for sperm. Eating more fish, we suggest 8 to 12 ounces of fish a week for the protein and also the omega-3. And interestingly enough, don't eat bacon. Why is that? Well, processed pork products tend to contain a lot of nitrites and nitrates, and there are studies to show that high consumption of processed pork products is associated with lower sperm count and motility, the function of the sperm. So when we're looking at supplements, I tell patients several topics, one of which you really need to know what you're taking. Please let us know what you're taking. There was a recent survey that showed only 28% of fertility patients told their fertility doctors what they were taking as far as supplements. So it's very important we know so we can make sure you're taking the proper supplements, and also the treatments that we're going to advise won't be interfere with your supplements. You really want to know the sourcing and the content of what you're taking, and that's where your provider, again, can help you, perhaps to guide you as what products they have experience or familiarity with and feel comfortable advising for you. I do tell patients for supplements to look at independent third-party certification because this will tell us that these products of their quality and purity. And ask for recommendations from your provider. Lastly, acupuncture. Acupuncture, there's a lot of interest in acupuncture. In studies show that patients undergoing in vitro fertilization, 25 to 50% of those patients are doing acupuncture during their treatment. The question is, does acupuncture actually improve fertility? Most of our information is through in vitro fertilization. There are 44 some studies now. The vast majority of them, we can't come to a universal agreement. About half the studies show acupuncture has benefit, and about half shows no benefit. The vast majority of patients undergoing acupuncture find it to be quite relaxing. They find it to be a pleasurable experience. It seems to give them more resilience and ability to go through therapy. It seems most beneficial if one starts acupuncture before beginning active fertility therapy. So for example, if a woman's doing in vitro fertilization, it might be best to start acupuncture a month before she starts her stimulation or so. For men, we don't have the same amount of information to say that acupuncture is beneficial, but if we look at sperm production cycles in men, we estimate that it might take as much as 3 months of acupuncture treatment if benefit is to be seen. It certainly is safe. It has no long-term side effects. It's a stress reducer. I do advise patients to consider acupuncture for those reasons. So when we're attempting pregnancy, it's important to plan ahead. Complete your testing beforehand, as I mentioned. If you have a chronic medical problem or process, we want that under control. Very important if you're on prescription medicines, herbs, or supplements, discuss that with your provider in advance so they can guide you in case there may be safer medications or medications one needs to stop once pregnancy occurs. And as I mentioned, the folic acid beginning at least 1 to 3 months before, 0.4 milligrams or 400 micrograms. Healthy, the Mediterranean or anti-inflammatory diet, a good multivitamin for women. Green tea is certainly something that may help improve fertility, but you have to be careful. It's got caffeine. Weight and exercise we discussed. Smoking, please stop if you're smoking. Marijuana use, limit or avoid. We simply don't have information. Alcohol, less than 4 beverages a week. Caffeine, about 200 milligrams, 12 ounces a day. And environmental factors. Sleep, stress management, and self-care all are part and parcel together. Taking time for yourself. One thing that's important is it's okay to have sex for couples. Around ovulation when you're attempting pregnancy. Have sex whenever you want, unless you're undergoing a procedure where your provider asks you to avoid intercourse at certain times. We want your sexuality to remain intact and not be altered by this process. And also, it's very important to communicate with your spouse, partner, friends, and family, and with the practice that you're working with. Thank you very much for taking your time to be with us tonight. I hope this has been helpful. We would be glad to stay on and answer a few questions.
You can stay here. Just go down to the bottom right where it says chat.
Okay. You want me to go on this one?
Sure. Go to the Q&A tab.
Okay. So we have a few questions. Catherine P. says, do you think it's safe to do a hysterosalpingogram the same month as trying to conceive? That's an excellent question. The answer is yes. Generally, we do the HSG, hysterosalpingogram, which is an X-ray to look at the uterus and tube, prior to the time of ovulation. So there are studies that show that women who conceive in the month of the HSG have no increased risk of birth defects or miscarriage. Catherine P. also wants to know, do you work with single women too? All language is couple-based. Absolutely. We work with single women, same-sex men and females, and transgender patients. I realize that it's always very difficult in a talk like this to try to be inclusive and say he, she, her, it. So please take no offense. We work with all patients. Another question we have is, does delivering a child previously impact a woman's ability to get pregnant as she gets older? That in itself should not impact the ability to get pregnant. It's really the age of the egg, not so much the age of the woman. If there's been a very complicated pregnancy or complications afterwards, where there might have been an infection after delivery, that in itself could affect the ability to get pregnant. But a woman's age generally does not affect her ability to carry a pregnancy. In fact, if a woman has been pregnant in the past, we generally look at that as a positive predictive value. Is a hydro flask okay for hot liquids? It would depend on what the material the hydro flask is made of. If it's made out of a glass or metal compound, yes. If it's made out of a plastic, I would generally avoid it. We have a lot of information about BPA, bisphenol A, but we don't have the same amount of information about other plastic compounds at this point in time. Is the folate or methylated folate better as an alternative to folic acid? There are a number of forms of folic acid. Folate is what we get in food. Folic acid is what we get in supplements. There is a movement to use the methylated or activated form of folic acid in supplementation. Theoretically, it may be beneficial in patients that may have some methyl issues, but there's no information to show that the methylated form is necessarily better than the non-methylated form of folic acid. Folate in diet and folic acid through supplementation are equally effective. This question, individual asked, I've been trying to conceive for over 2 years. We are out of options and desperate, and we do not have insurance. Are there any options or help from us? Well, unfortunately, without knowing a little bit about your medical history and what treatments you've had, that's a hard question for me to answer. There are a number of options always available. It really is going to be based on an individual or couple situation as to what treatments we think might be of value for them. So that's a question I honestly can't answer without further information. That's something that your provider or providers you see should be able to answer. Or if you haven't got the answers you want, you might want to seek a second opinion, have somebody review your medical records, your treatments to date, and give you their opinion on what options may be available for you at this time. Are there any supplement brands that I tend to really like? One that I actually really like, and I will give you one proviso: I get no rebates from any pharmaceutical or drug company, so I don't make money for anyone. I happen to like nature-made products. They're usually easily available. Their price point is good. Nature-made, a number of their products now are NSF certified. NSF is an independent third party that certifies supplements. So they've gone the extra mile to look for making sure their products are of good quality and purity for you. So Nature Made is generally the brand that I would say over the counter to look for. And we're out of time. Again, thank you very much for joining us tonight. I wish you well in your journey going forward. Have a good evening.